Hello, my name is Drake Basson, and I'm a nursing student at Indiana University, and this is my community health nursing project that women are at increased risk of developing breast cancer. I thought this was an appropriate topic for October since it is Breast Cancer Awareness Month. My objectives are for this project are prevalence of breast cancer among women, risk factors that cannot be changed, risk factors that can be changed, prevention of breast cancer, screening for breast cancer, and future of surveillance. Now I'd like to pause for the pretest. Here is the pretest. Thank you for taking the test. Now I'll begin. Prevalence of breast cancer among women. Out of every 8 women, 1 will have a chance of breast cancer. Being born a female and age are the most defining risk factors of breast cancer. African American women have a higher chance of getting diagnosed before the age of 50. Mortality in African American women from breast cancer is higher than in other populations. The BRCA or BRCA gene is the most prevalent in Jewish populations that can also increase the risk of breast cancer. Breast cancer is the most prevalent cancer diagnosed in all U.S. women. Having a close relative, such as a sibling or parent, greatly increases or doubles the chance of getting breast cancer in the lifetime. Risk factors that cannot be changed: being a female, aging, having genetic dispositions that are known to cause breast cancer, having a family history of breast cancer, being taller than average, breast tissue that is dense, early puberty before the age of 12, and late menopause after the age of 55. Risk factors that can be changed: regular exercise, eating whole nutrition with fresh fruits, vegetables, and less processed foods and sugars, minimal alcohol consumption, avoiding all smoking, nicotine, or stop, weight management, avoiding obesity, being aware of a family history, and take steps to maintain healthy life choices. Prevention of breast cancer. Being aware of personal risk factors is important to prevention and/or early diagnosis. Modify lifestyle by choosing to exercise daily for at least 30 minutes, choosing healthy foods to consume, avoid alcohol or limit the amount consumed, not using hormone therapy for postmenopause, breastfeeding, surgical procedures for higher risk individuals with BRCA1 or BRCA2, medications known as endocrine prevention that prevent hormone-related breast cancers such as estrogen. Screening. Screening is used to decrease the amount of people that are diagnosed with breast cancer. Also to decrease the death rates from having breast cancer. To determine if and who is at higher risk for breast cancer and modify their screening if needed more frequently. Self-examination of breasts once a month, professional exams once a year, and radiology exams such as an MRI, ultrasound, and mammograms when appropriate for the individual's risk factors and age. Symptoms to be aware of. Most women do not have any physical symptoms before being diagnosed with breast cancer. However, any breast changes or hard lumps felt, a nodule or lump under the arm or armpit area is warranted for a medical exam. Also, nipple drainage or changes in the nipple itself, such as inversion, as well as redness, swelling, or rash, and skin changes in the breast. Pain that lasts in an area or to the breast should also be a reason for medical attention. Future and surveillance of breast cancer. Researching the cause of breast cancers related to hormones, toxic exposures from one's environment will all help in prevention of breast cancer. Implement ways to diagnose and treat breast cancer early on as much as possible. Manage individualized plan of care specific to each breast cancer diagnosis, since the causes are often not the same. surgical interventions as prevention and treatment standards including lymph nodes, using radiation at lower levels whenever possible, and offer therapies for prevention and treatment to women that are at higher risk due to their genetics or family history of breast cancer. In conclusion, overall, breast cancer is the most often diagnosed of all cancers in women. All women are at risk for developing breast cancer, especially with each decade of life. There are known disparities in minority populations such as African American and Hispanics from diagnosis to treatment of breast cancer and less survivors compared to Caucasians. Eastern European origin have a higher rate of genetic abnormality related to the BRCA1 and BRCA2, which are highly related to breast cancer and some ovarian cancers as well. Education to specific populations and awareness is vital to early screening and diagnosis and ultimate treatment if needed. I wanted to include this breast cancer risk assessment tool, which is offered by the National Cancer Institutes. And you can click this link below, and it's a great tool for especially healthcare providers to determine the risk factor. This assessment can give a woman's lifetime risk of being diagnosed with breast cancer within a 5-year period of time and can be calculated until the woman reaches 90 years of age. The risk is determined by an in-depth health history of the woman and a family history of breast cancer, such as a parent or a sibling, which gives the absolute risk of breast cancer in a specific age range for that individual based on the risk factors gathered. However, limitations are that the genetic factors, such as the BRCA mutations, past medical history of breast cancer, and minority groups are not well represented in these risk assessments and therefore cannot be accurately assessed by this method all the time. However, there are assessment methods that are more specific to the groups mentioned above that can be helpful in determining risk factors and proper screening. Here are some additional resources if you would like to check them out. First one is the SusanBKomen.org, which is, I'm sure everyone is aware of the Komen breast cancer walks and runs that are around the country. And also the nationalbreastcancer.org is another good site for patients, families, and healthcare providers alike. Don't forget to take the post test. Thank you for listening to my presentation.